I want to say hello to you, the citizens of Randolph County. I'm coming to you today representing the Randolph County Board of Commissioners as a part of our process to keep you, the citizens, informed and provide all the available information that we have to the citizens of Randolph County. To help this, to accomplish this, we will be providing this video and updates twice per week on Tuesdays and Thursdays. These will be posted on the county website for your access. The purpose of these videos is to update you, the citizens, on the county's coronavirus response and a response to the crisis situation that it has created within our community. We also want you to know that there is assistance available to you, the citizens, for you to take advantage of. There's a place for you to find answers to the questions that you have for your families. I also want to say that through this process, it is pointed out the importance of having a hospital here in Asheboro and in Randolph County. It is your right to know of these cases as they are confirmed within the community. We work with those in authority to provide these updates as we receive them. The Board of County Commissioners will continue to work with the professionals of Randolph County government to keep you, the citizens, informed. As has been said so many times, we are truly all in this together, and each one of us has a part to play in keeping our community safe. For this first countywide video this morning, we're going to present to you Ms. Susan Hayes, who is the Public Health Director for Randolph County, Mr. Donovan Davis, who is the Director of Emergency Services for our county, and Mr. Hal Johnson, who is our County Manager. In closing, let me say to you that the Board of County Commissioners is working hard day and night to ensure the public safety and well-being of you, the citizens of this county. That is our first and most priority as we go through these days ahead. So with that, I say God bless each one of you, your families, and this county, our state, and our nation, and those who are making the decisions every day that affect our life and help us to convey those responses to you, the citizens.
Well, good morning. I'm Susan Hayes. I'm Randolph County Health Director, and I just wanted to take a minute to tell our citizens that we are working on your behalf during this COVID-19 outbreak. We're doing our best to keep Randolph County healthy. I wanted to remind you, though, of things that we should keep in mind when we're in the public and we're out and about. According to the governor's order yesterday, we should be ramping up our social distancing. We should be staying away from crowds that are greater than or equal to 50 individuals. We also should be staying out of close contact with restaurants, beauty salons, tattoo parlors, any place like that you're going to be in close contact in your community. I do want to also let you know that yesterday CDC updated the guidelines on those individuals who are most at risk, and it now includes those that are obese, so people that are age 65 and older, those with underlying comorbidities or underlying conditions such as heart disease, diabetes, those kinds of things, lung disease, asthma. Also, those individuals who have a compromised immune system, and pregnant women. Pregnant women should remain vigilant to stay out of the public. We know that they are at risk for severe complications from the COVID-19 virus. So again, to that list, we have added those that are obese. So if you are overweight, you've also got an increased opportunity for severe conditions related to COVID-19. As of 8 o'clock this morning, Randolph County has 3 laboratory confirmed positive COVID-19 tests. Not all individuals who get COVID-19 need testing. So we encourage you that if you have symptoms, cough, fever, shortness of breath, that you stay at home, self-isolate, and call your physician. If you're doing well, you should be able to stay at home and monitor yourself without any further issues. The majority of those individuals who do get COVID-19 do recover without any complications. So please heed the recommendations of social distancing, staying at home as much as possible, keeping 6 feet away from people, washing your hands as often as you can, more than you ever have ever in your life. That will also keep you from getting the flu, which is still circulating throughout North Carolina and the United States. And in addition, make sure that surfaces are wiped down and cleaned frequently. Those surfaces that are touched often should be cleaned often. So those are things that you can do. And I also want to say that you should make sure that you stay informed. Go to the county website, go to CDC's website, go to the North Carolina Department of Health and Human Services website. Those are the resources that you should be using for your information about COVID-19. And we do have a hotline open with public health at our Emergency Operations Center. It is 336-318-6227. We will do our very best to answer your questions there. You can also dial 211 and get questions answered about the COVID-19 virus. Thank you and take care.
In the Emergency Services Department, we've changed a lot of our protocols for 911 and EMS. Every caller now who calls 911 will be screened. If they have flu-like symptoms, then we share that information with the responders. And we ask, in some cases, if the person who wants to meet with a responder can come outside of the residence. Anything that we can do to protect our first responders in this event. Our EMS is prepared to respond to anything that may occur or additional call volume that happens because of COVID-19. They've been relearning and making more stringent effort in cleaning and procedures as that. My department also is supporting our public health department in the Emergency Operations Center to provide them staffing and resources. In addition, in the Emergency Operations Center, my staff is working to provide additional resources. We're the liaison between Randolph County and State Emergency Management, and we are supporting all of the agencies around the county who may need additional resources.
Thank you, Chairman Darrell Fry, Public Health Director Susan Hayes, and Emergency Services Director Donovan Davis. The most valuable resource a citizen can have in a time of emergency is information. The purpose of these regular county videos is to provide our citizens with up-to-date information about your county government resources and how we are organizing and operating to protect and serve our citizens during these challenging times of the coronavirus pandemic. In 2019, our Board of County Commissioners adopted a county business continuity plan, the first ever in Randolph County. It was designed to ensure that your county government could continue providing services in the event of unexpected crisis. Part of this business continuity plan was the establishment of a crisis management team. This team consists of county professionals from public health, emergency services, law enforcement, human resources, risk management, information technology, legal, and our administrative staff. This crisis management team reports directly to me as the county manager and offers a wide range of insight, knowledge, and experience that will help tackle the challenges presented by the ever-changing COVID-19 coronavirus pandemic. Because we are all one Randolph County community, I have made available to our municipalities, if needed, the expertise provided by the county's crisis management team. Due to the current COVID-19 outbreak and the recommendations of the Randolph County Crisis Management Team, and under the authority given to me through the local state of emergency declared by County Commissioner Chairman Darrell Fry, I have directed that a mandatory reduction in the number of county government employees reporting to work at their normal locations begin implementation effective immediately. The purpose of this mandatory reduction in normal work locations is to reduce potential contact with this virus for our staff and the citizens that we serve and depend on us. The goal of this policy is to have as many county employees as possible stay and work at home in order to halt the progression of the COVID-19 virus. The essential county services upon which you depend will continue. This redistribution of normal work locations by county government employees is not a decision that we made lightly. The situation created by the coronavirus is one that changes daily, and that it is unlikely that it's like anything that our community and our local government have dealt with previously. In implementing these preventive measures, your Randolph County government is doing all we can to protect our employees and the citizens we serve from the spread of this virus. Equally as important, we take proactive actions that will allow Randolph County government to continue to provide those services that are critical to the public health, the public safety, and the well-being of our citizens. Thank you.